एडिशन सुना है अच्छा ना
ठीक है
today we discuss with the topic related with the congenital infections. In last lecture we already done the lecture on the disease of infancy and childhood. So the name of the unit in general pathology, the disease of the infancy and the childhood, comprising a lot of diseases which can occur during the gestation period, and some other kind of infection, and they will also occur in the gestation period. The congenital infection, and they will also can be the major, most probably the major characteristic features of the congenital infection. So first of all, these infections, they will also can be spread or the transmitted and from the mother to fetus. They also can by the few routes. Number one, they are the transplacental. First of all, it is also a transplacental transmission. So the also having the comprising a lot of various microbiological agent which can be including viruses and also the bacteria and parasite, and they will also can be causing the some diseases, and they also can leading to some clinical manifestation. So the similar clinical features and also and they also can produce a multi-organ systemic infections. So the list of the number one, the pathogenesis of the congenital infection, and they will also can be causing, and they also according to the frequency, some bacteria, viruses, and parasite, and they are the more frequent, and some are the less frequent, and they are the some other agent, and they are the rarely they can cause the diseases. The group of the viruses, most importantly cytomegalovirus, and also the herpes simplex virus, and also the rubella virus, and the other the herpes, there the varicella zoster virus, HIV. So these are list of the there are the parvovirus. So these is the list of the viruses, and they also can causing the disease in the infancy, and also they can produce the kind of infection. A list of there are some bacterial causes, and they also can causing the infections, and they are most probably the chlamydia, trachomatis, and also the other the most common they can producing the Neisseria gonorrhea, and also the some other like the other most probably Treponema pallidum and the Mycobacterium. They can produce the mycotuberculosis, and tapeworm pallidum they can cause the syphilis. And so the list of the parasite, they are the most common parasite they can causing the congenital infection. They are including the toxoplasma, toxoplasmosis, as they also can produce in toxoplasmosis, and in the different age group. Now the most probably, first of all, the clinical features, and the congenital infection, they also can leading to the some there the generalized disease of the fetus, or they also can occur with the newborn, the most commonly, and the clinical manifestation they also can occur in the intrauterine growth retardation. Number one, they also can producing the the non-immune hydrophytalis, and they will also can be, it is also generalized. In the last lecture we already done the hydrophytalis, and some there the anemia, and there's a leukopenia. Anemia, there's a decreased hemoglobin concentration, and also the leukopenia, there's a decreased number of the leukocyte, and thrombocytopenia. So they also can producing the bleeding tendency, bleeding disorders, and they decrease the platelet count. So the jaundice, and also the hepatosplenomegaly, they also can producing the enlargement of the spleen along with the liver. So there the chororetinitis, and they're also having the encephalitis. So these are the some manifestation they also can occur, and the pneumonia, most probably there's the pneumonitis, and also the some there the other condition there the myocarditis. So these are the some clinical manifestation. They are also leading to the some other caused by the bacteria, viruses, and the parasites. So some there the congenital most probably infections. Congenital infection, they are also having the list of the groups. Number one, they're the most importantly viruses. So there is a cytomegalovirus, and this is the most common frequent congenital infection. They also can occur in the fetal. There's the infections. They also can occur in the infection that can commonly occur in the pregnancy. About the 35% of the रिस्क फॉर द फीटस जो रिस्क होती है वो 35% फीटस में रिस्क होती है. दे आल्सो कैन प्रोड्यूस सम इन्फेक्शन. So there these this infection they also having the early gestation, and some there they also have changes in earlier gestation, and also the mothers, and most probably the mother's primary infection they also can be occur, and they also having the more symptoms they also can be occur. So reactivation of the latent period, latent most probably latent maternal infection. They also cytomegalovirus infection. They also can leading to the some part of the about 35% of the cases. So the symptom they're also having the asymptomatic disease of the newborn about the 10% of the cases. So 90% is also having the asymptomatic. So 10% of cases low birth weight. They also can producing the low birth weight for the gestational age. जो बच्चा जो during the gestation period उसका low birth weight होगा. Then they also can producing the jaundice, and also the some there the hepatosplenomegaly, and they also can producing, and some there the hepatitis, and also the also having that it does not most probably does not become the chronic. Okay, chronic नहीं होगी. उनके बाद they also having that is some features on the body. They also can put blueberry that the muffin spot ये rashes होंगे. ठीक है बेटा, तो ये blueberry muffin rashes. So these patients they can cause by some cytomegalovirus infection. They also can producing the 10% symptomatic disease of the birth. जो birth के टाइम पे 10% symptomatic होंगी, low birth weight होगा, and then low birth weight. There are for the gestational age, the jaundice, and the splenomegaly, and the hepatosplenomegaly, and also the some patients also develop the hepatitis, does not producing the chronic state. So the blueberry muffin spots, and also the they're also having the leukocoria, and also there is the coordinatis. So there is also some the microcephaly. ठीक है बेटा, तो ये microcephaly is also kind of an anomalies. They also can producing this part of the infection. So this is also a photograph of the blueberry muffin spots. And they also can producing the endodermal. There the hematopoiesis. ठीक है बेटा, endodermal hematopoiesis. They also can producing the muffin rashes on the on the body spot. They also can using the blueberry they like as a blueberry color, the blue color. ठीक है बेटा, तो ये जो these are the features that also can be commonly occur in case of cytomegalovirus anemias, and they are also having there the most probably leukopenia, anemia, leukopenia, and also the some there are the infections. Okay, thrombocytopenias. So now the asymptomatic of the asymptomatic infections, they also can occur about the 90% of cases become asymptomatic on the birth. अच्छा, उनके बाद most of 10% of the fetus they also developing the symptoms, and they also having the 10% सिम्टम डेवलप होंगे, ठीक है बेटा। उसके बाद दे आल्सो कैन प्रोड्यूसिंग दी सेंसोरी न्यूरल हेयरिंग लॉस होती है। उसके बाद दूसरी जो फीचर्स होगी नंबर 1 एंड देन आफ्टर द कोरेटिनाइटिस and then after a patient they are also having their in the later infection they are also having their later in the childhood they are also having their childhood diseases disorders and of the and most probably that's how do the psychomotor developmental disorders they also can be occur. Okay, so they also having there is some they also can be called as a asymptomatic infections they also can produce coronavirus and also the some there the hearing loss. So they also can produce some most importantly comprising of about the 10% of the cases. So sensory neural hearing loss, so it also can be associated and with the genital infections. They also can produce in some ratio of about the 100 genital cytomegalovirus infection. They also can producing. Now, how we can diagnose a case of cytomegalovirus? We also can take the specimen from the urine sample and also the saliva and the blood and the cerebrospinal fluid. They also can be helpful for the diagnosis. So the culture of the viruses most probably they also can be given. So there is standard, most probably there is standard culture. They also having there the several weeks. They also can require the for several weeks. So culture and plus most probably they are also having there the monoclonal antibodies and they will also can be helpful and further to reach the appropriate diagnosis. Some there is serological examination, serological test, and they will also can be helpful and for diagnosis of the case of the cytomegalovirus infection. So how we can diagnose, how we can treat the patient by the therapy. So we also can give in the antiviral drugs. They also can be again cyclovir. So it also can be may also can be halt the. They're also having the progression of the hearing loss. They also can giving the antiviral therapy and cyclovir. So now another most probably there is the toxoplasmosis is also parasitic infection and they will also can leading to the some disease in the fetus. Some there this parasite they also can be usually they also can occur during the mother's most probably there's mother's primary infection. Okay, they also can be caused by the Toxoplasma gonadie. Most viral infection they also can be this type of the parasitic infection which can occur and who also can be contact with the persons with the contact with the cats and along the pets. So they also can developing the Toxoplasmosis gonadie. Reactivation of the latent infection they also can be extremely rare. Reactivation नहीं होती, rare conditions होती है. So there's the transmission rate is also most probably there is the overall about the 30% of the cases, 30% to 40% of the cases oral transmission of the toxoplasmosis gonadie, about 30 to 40% of the cases with transmission of the most probably. So the most probably the most common symptoms of the they also can be caused by the toxoplasma gonadie. They also having there is some there is severity of the fetal diseases, severity of the disease, and some there is also having there is high risk. So severity of diseases. So the most probably there is allele infection. Most probably they also having there the allele infection, and they also can be it is a more severe. Most probably there is a more severe more severe symptom they also can producing in the severity of the infection. In the high risk they also can be high risk period most probably also can about the 10 to 24th week of the gestational period a week होता है उसके दरमियान होती है high risk about the 10 to 24 weeks जो 6 महीने तक की तकरीबन जो है ना 2.5 महीने से लेकर 6 mainly the most probably high risk होती है for the transmission of the infection. It also can be most probably they also having the developed there the placental placental blood flow. They also having there the placental blood flow. So these are the most commonly occur at the 10 to 24th week of the gestation period. So how we can asymptomatic diseases of the birth. Okay, so the in the most probably in the most newborn babies, the newborn most probably with the with no any obvious, most probably no any obvious symptoms at the birth. Okay, so they are also having their but by the most probably there is the but there is detailed there is the examination, detailed examination. They also can be revealing revealing first of all there are also showing the choretinitis, and also there is the development of the there is the intracerebral calcification, intracerebral cortical calcification. They also can be occur. So they also, and within the uh, with inflammation, with inflammatory cerebrospinal fluid, and so they are also having the signs of the uh, hydrocephalus. So these are the some manifestations. They will also occur in the asymptomatic disease of the at the time of the birth. Most probably they also can develop the in the most of the cases. They are also in the newborns. So with the newborns, they also can show the symptoms, but and by the detailed examination of the detailed examination, they also can revealing first of all they also develop choretinitis. उसके बाद जो है ना वो they also can producing the intra cerebral cortical calcifications, and along with the inflammatory cerebrospinal fluid, and the signs of the hydrocephalus. So that there is a symptomatic disease of the at the time of the birth. Most probably there's a develop the low birth weight. तो सिम्टम में जो डिजीज होगी उनमें लो बर्थ वेट बेबीज होंगे, ठीक है। उनके बाद लेटर मोस्ट प्रोबेबली दे आल्सो हैव डेवलपिंग द जॉन्डिस and jaundice in early cases and early and within the 24th postnatal post 24th जो आवर्स के दरमियान उसके दरमियान जो होंगी वो उनको जो जॉन्डिस डेवलप होती है, ठीक है, इन बेबीज में। जो जिस तरह से हम दियासो कैन डेवलपिंग दी सम दर्द है 24th वीक में जो जॉन्डिस होती है, दियासो कैन सम डेवलप द पैथोलॉजिकल जॉन्डिस. ओके, so there are also patients and fetus they also develop the hepatosplenomegaly. So the other there the maculopapular rashes, so they are also diagnostic feature, and also there is also in there the so there's a triad. First of all there is choretinitis, and also the cerebral cortical calcification, and along with the some there the scissors होते हैं, ठीक है बेटा। तो इसके बाद जो these are the some manifestation they also can occur. And so how we can diagnose a case of toxoplasma gonadie? So first of all, serologically we can give the serological test, and for the antibodies in immunoglobulin IgG, there are the seroconversion, and are the most probably four about the or the fourfold they also can be increased, rise होते हैं, ठीक है बेटा। उनके IgG जो titer होता है seroconversion and or the fourfold they also can be raised, and about the 1 to 2 months, 1 to 2 months and to the active period, ठीक है। एक्टिव जो पीक में होते हैं उसके बाद they are having there the presence of the IgM and IgA and or the IgE, immunoglobulin E, Ig immunoglobulin A and Ig immunoglobulin A, immunoglobulin M. So these are the antibodies, and they will also have they confirm the diagnosis. And the first of all we also can be take the help from the for diagnostic purpose. We can do the immunoglobulin IgG seroconversion, and the seroconversion and about the fourfold they also can be raised, and the time of the 1 to 2 months and to become active. active period, and then after we also can we do the first of this, we can see the presence of the immunoglobulin A and immunoglobulin A and or immunoglobulin E, confirm the diagnosis. And PCR, polymerase chain reaction, they also helpful. And for the some the histological examination, examinations and of the most probably the examination of the biopsy of the placenta, also can be helpful for the study examination by the placental tissue. Now the other most probably the other diagnostic most probably their measures and procedures, and then after first of all there the ophthalmological examination, and then after there the hearing, most probably there the hearing resting hearing testing, and there the auditory most probably there the auditory evoke test. ठीक है बेटा, तो ये potential देखते हैं, evoke potential, and then also can do the CT scan and of the brain, computer topography, and also the LP lumbar puncture for the taking the specimen of the cerebrospinal fluid examination. So these are the other mere further to reach the diagnosis. So this is also a pictures of the a case of toxoplasmosis. They are also developing the choroiditis and also the some development of the calcifications and hydrocephalus. So these are some features, and they are also developed by the toxoplasmosis infection. Now we can give the therapy. There is the pyrimethamine and plus there is the sulfadiazine. So these are the some drugs, and for the to also can be given the 12 months. They also can given pyrimethamine, there is the pyrimethamine and plus the sulfadiazine, and other therapy. There they also having there the therapy of the infection, therapy of the infected or therapy of the infected pregnant woman, and we also can be if an infection, infection they also can be developed most probably there before the birth. They also can developing the therapy. So now prevention, how we can prevent the case of the toxoplasma. So they are also having there the to prevent most probably to prevent the infection of the pregnant woman. First of all, there the cooking of the food, and then after and or the freezing freezing, or also the some there the freezing or the below about the 20 degrees centigrade, and then after they also can be first of all, and then there the through hand washing and by through hand hygiene, and we also can preventing, and they also can prevention from the close contact and with the cats. Okay, so there after there is also having the contact with the cats. So how can, and another most probably the viral infection, the rubella viral infection. So there's the rubella, also infection, they also can occur at the time of the pregnancy. There's also a primary infection of the mother at the time of pregnancy. So it is also a minor disease, and they also are developing the fever and along with the rashes. So serious, most probably they're also having the serious, and for the fetal diseases. So minor disease जो मदर के लिए होती है, उसके साथ जो ना वो serious symptoms they also can producing in the fetus. About it, some there the changes also can occur by the week of the eighth week of the gestation. They also developing the 85% of the 85%, and with the congenital defect they also can occur at the infection. They also can spreading at the and by the week 8th week of the gestation. So they can develop 85% of the infection. So about the 40% of the spot most probably they are also having the spontaneous, most probably they also can abortion, they also can occur the first fourth week of the gestational period. They also can developing the chances for the abortion and by the causing the some the rubella viral infection. So this is also can be first of all there the after the gestational week after the gestational 20 week 20 they also can be developing some there the congenital defect abnormalities. They also can be do not appear. Okay, जब वो later peaks में होंगी तो they also can produce some they cannot be producing some symptom, there the there the most probably there the chronic infection, and they also having there the chronic infection. They also can producing the inflammation. They also can be possible. Okay, so the most probably they also can affected organ. They also can be caused by the rubella infection. First of all, eyes, and then after, and then they are showing that the hearing, and then after the uh, CNS in the brain. They are also the most common affected organ by the viral infection. First of all, there is clinical manifestation. They also can be caused by the viral infection. They also can put in the congenital malformation. First of all, there is generalized diseases on the birth, produce generalized diseases. Number first of all, there's asymptomatic infection at the birth. So first of all, they also can, and then after the congenital malformation, they also can be caused by the rubella virus infection. And there's the cardiovascular abnormalities. They can go in the involvement of the heart. So they're also producing the patent ductus arteriosus, and then after there the pulmonary artery stenosis, and then after there the ventricular and atrial septal defect. So and then eyes, most probably they also having there the cataract, and also there is choroiditis and glaucoma, and some there the hearing loss, and there are showing there the sensory neural hearing loss, and also some there is damage of the central nervous system. They also can producing the some there is also a microcephaly. So they also can produce microcephaly, hydrocephalus. So they also having there the most probably intracerebral calcification. They also can producing. So they also can produce in the three main system: eyes, and then the central system, and also the heart. And they also can producing some other the disease by the caused by the rubella viral infection. They also can producing the canal malformation. So this is also a gross most probably photographs of the patent ductal arteriosus, and that's can producing the patency and also the microcephaly. So they are showing that this feature of the microcephaly, and also the this in the literacy there's a cataract formation. There's the opacification of the lens. Now there's the symptomatic infection of the birth. So most of all of the birth, there is generalized, newborn diseases. Most probably there is low birth weight. Most probably also can cause the low birth weight, jaundice, and there is hepatosplenomegaly, and there is thrombocytopenias, and there is purpuric about the there the blueberry muffin dishes. They also can occur, and there the pneumonitis, and also the some there the meningoencephalitis. So these are the some features. They also can occur symptoms. There's symptomatic infection. They also can occur at the time of the birth. There's a generalized, most probably there the generalized newborn diseases. Now they are also having the asymptomatic diseases, and some there first of all they are also developing the it is often there is lower birth weight, most commonly occur the lower birth weight, and there the later may also may become apparent, and they also can developing the sensory neural hearing loss, and also the glaucoma, cataract formation, and also the central nervous system damage, and also the behavioral disorders, so behavioral disorders, and also they also can developing the mental tradition. So these are the some asymptomatic infection. They also can producing the some abnormalities. They also can occur in case of the rubella virus infection. So how we can diagnose a case of the rubella virus infection? So there are some tests for the doing at the time of the postnatally. Postnatally, some there is serological examination. There also can be detection of the and the antibodies, antibody IgM, and there also can be IgM. There also can be evidence of the infection. Most probably there's the fetal infection, and they're also having the other. Most probably there's the it also can be produced only by the child. Okay, so they also can the other feature IgG, and they will also can be initially the IgG initially there also can initially and can be most probably they're the maternal. IgG is maternal, so there the letter only there also can be child IgG. There also can be remains. So other than the prenatally, we also can be done. There is some the viral culture. Prenatally, we also done the viral culture of the often most viral infection or viral culture often there the amniotic fluid. So initially, at the time of the prenatal period, we also can do the viral culture of the amniotic fluid, and there the RNA hybridization and form the biopsy from the biopsy chorionic villi. So they also can be doing the RNA hybridization. So the how we can prevent the infection? First of all, we also can give the MPR vaccine. They're also having the vaccine, and it's a live attenuated vaccine, and they also can be given during the second year of the life. Second year of the life, we also can be given the MPR, and also and at the beginning, most probably they also can occur at the beginning beginning of the elementary school age group. Okay, and also the some there are pregnant women we also can be uh, not to be vaccinated. Okay, so another viral infection they also can be caused by this is the parasite infection. We already done the three mononucleosis herpes simplex viral infection. There the type 2 and 1 and the type 2. So they're also having the first of all epidemiology 90% of the herpes simplex virus infection they also can occur and during the delivery of the fetus. Okay, so the herpes simplex virus 2 in the also can occur in the 80% of the cases. Okay, so the herpes simplex virus 2 they also can occur 80% of the cases. It is also most often they also can become the symptoms of the genital herpes viral infection, and they are also can be absent. Thus, in the absent in the mothers. Okay, pathogenesis. How we can this infection they also can be caused by the herpes virus. So they also having the most probably the intrapartal infection. Intrapartal infection they also can be a source of infection and through the vaginal secretions. The infection they also get transmitted through the vaginal secretions, and they also having the uh, interest. Most probably there the conjunctiva or the respiratory mucosa. They are the most common routes and for the transmission of the herpes infection. First of all, they are the conjunctiva and or the respiratory mucosa. Now there is clinical manifestation of herpes simplex, and there are also having that from the mild diseases. From जो mild disease होती है, most probably they also can produce vesicles and or there is scarring of the skin. Most probably they also can produce vesicle and the scarring of the skin, and they also can producing the on the mucous membrane. The mucous membrane around they also can producing the vesicles and other scar. And also the also having the severe disease pattern, they also can producing the they're the generalized, most probably they also can producing the generalized, and they're the disseminated diseases. They also can producing there the encephalitis, and also encephalitis as the most probably the only manifestation of this case of the herpes 2 virus, the generalized pattern. So there's so other there the pneumonia as the most probably is the only manifestation that also can occur. The most common they are the encephalitis and also the pneumonia. So there are disseminated diseases. Disseminated diseases are the healthy. They also can producing number one. There the patient also developing the case of the herpes simplex virus 2, and they can developing the disseminated diseases. They can produce the hepatitis, and there the myocarditis, and they're developing the pneumonia, and there the development of encephalitis. In case of the disseminated diseases caused by the herpes simplex, there the choroiditis, and there the keratoconjunctivitis. So these are some diseases can be caused by the disseminated infection, rashes, and they also producing the vesicle, and there the bully formation. Bully जिस तरह boil होते हैं, bully formation they also can occur on the skin in the 70% of the cases. 70%, and they also can facilitate. Okay. And these manifestations they also can facilitate and to help the diagnosis for a case of the herpes simplex virus 2, and in case of the disseminated diseases. How we can diagnose a case of the herpes simplex? First of all, there is the specimen collection. Specimen collection, we also taking the swabs and also the aspirations and aspirates, and of the most probably the vesicles and conjunctiva, and also the some there are the nasopharyngeal secretions, nasopharynx, and also there are the uh, rectum. So these are the also taking the rectum. These are the most common, and blood and cerebrospinal fluid and the urine, and also there are the stool. So these are the some a list of the specimen collection, and further to read the helpful for the diagnosis. So we also can be doing the some there are the methods we also can doing. First of all, there is the viral culture, and for the and then the PCR polymerization, and they are also having there the evidence of the viral DNA. So these are the tests for the diagnosis for the case of the herpes simplex 2 infection. So the therapy we also can given in case of the there the acyclovir, and also can given IV drug therapy, and uh, for the decrease the progression of the herpes simplex virus infection. So the how we can prevent a disease, and they also can be depending on the circumstances of the circumstances of the most probably of the infections. First of all, there the primary infection of the mother, and also the and there's the risk for the child is about the 50% of the cases. Okay, some there the immuno, and there are also initially there the most probably there initially introduced, and there's also initially introduced acyclovir, there's a therapy acyclovir therapy, and for the mothers. Okay, and then after we also can be recurrent, there are also the recurrent genital herpes. We also can be prevention from this. We also can be give the treatment and for the genital herpes. So another syphilitic, there was bacterial infection, they also can have the less frequency. So they are the syphilis. So that's what called by trypanopellidum. So the hematogenous, this infection, they also can be spread through the hematogenous route. There's a transplacentally and transplacentally. So the mothers, most probably, they also can be, it's the most common infection, and they also can be caused by the contact and with the, they also can be contact with the mother's chancre, mother's chancre, and they also can occur during the birth. So this infection, they also can be transmitted and through the contact with the mother's chancre during the birth. So rare भी होती है, and then after this disease, and they also having the time of the symptoms of the symptomatic diseases. There's a symptomatic at the most probably at the birth. First of all, there the late neonatal onset, most probably they also gonna occur later neonatal onset, and within the fifth week of the fifth week, they also gonna occur the postpartum age group. They also having their this disease also having the later onset, and after the 2 years of age. So they also can produce some, there is symptomatic infection. They also can produce most probably there the called stillbirth, and they also having there the generalized infection, the generalized there the neonatal diseases. They also can be caused. First of all, there is a low birth weight baby. There the hepatosplenomegaly, and they also can producing the hepatitis, and they also having there the non-immune hydrophytalis, and then the hemolytic anemias of the newborn. So they also can producing the some disease and symptoms. They also can occur caused by the syphilis, and there is the neutropenia and also the thrombocytopenias. They are the most commonly also can occur by the caused by syphilis, stillbirth, and also the some there the generalized, most probably they're the neonatal diseases, and they also can list in the low birth weight, low birth weight babies, and along with the hepatosplenomegaly, and other there the non-immune hydrophytalis, and other there anemias, hemolytic anemias, and neutropenias and thrombocytopenias. There's the late neonatal diseases. So they also can, first of all, there most probably the osteochondritis, and they also having there the metaphysitis, and this type they also can periosteoitis. So periosteoitis, and they also having there the newborn formation. So other most probably there's also rashes. Most probably there the maculopapular rashes होते हैं, and they also can occur desquamation, and also the some there the syphilic, most probably they also having there the syphilic rhinitis. Okay, so they also having there the some hematogenous, most there is the hemorrhagic, most probably. So also having there the hepatitis, and also the some there the lymphocytosis. So these are the some features that also can be caused. Some there the keratitis होती है in patients में, and most probably cerebrospinal fluid for the diagnosis. So these are also having the these are the some symptoms. The later clinical manifestation, and the most probably occur in the neonatal diseases pattern. So this is also some features of the syphilis patient. There is the late onset of the diseases. Most probably they also can occur. Some the Hutchinson's triad. First of all, they also having the interstitial keratitis, and also the other disease like as a There it's now most probably there the damage होती हैं, it's enough have damage, and they are also having there the other features like the Hutchinson's teeth. So these are the some clinical manifestations also can caused by the syphilis. It's now damage होती है, ठीक है. So these are the some clinical manifestation occur by syphilis. The most probably there's a late onset of the symptoms. They are also having the most probably the now we can also having that how we can diagnose a case of the syphilis patient. First of all, serological test we also come done, and then now the serological test and for the diagnosis. How we can treat the patient of the syphilis, penicillin G, and also they also can give in IV by the 2 weeks, and also there's also a therapy and further decrease the infection. So Guillain-Barré trachomatis and also can producing this is also a bacterial infection. So it is epidemiology. Most probably the source of infection is also from the mother and with the mother with the general infection. So the source of infection they can cause by the Guillain-Barré trachomatis, and they also the from the source and from the mother and with the general infection, and also the infection they also can be occurs and during the most probably child there's the child birth at the time of the birth they also can produce infection. So these are the symptoms that also can be caused by the Guillain-Barré. They are also having the conjunctivitis, and also the 5 to 14, and they are also having the day of the life. They also can occur. Okay, this disease also can occur conjunctivitis. Other they are having the conjunctival. Most probably there is the redness होती है, watering होती है, eyelid. Most probably watery discharge उससे होती है, and sometimes they also can become watery, then become the purulent. And how we can most probably and the other manifestation they also can be caused by the Guillain-Barré, by the pneumonias infection, and also they also can be occurrence of the pneumonia at the time of the and there is a 2 to 9 there also can occur and the 2 to 19th weeks of the age. Okay, at the time of the and it is also a patient they also developing the no fever, and also the developing the dyspnea and attacks of the cough. Some there the chest X-rays, and they also can showing there the diffuse, most probably there the diffuse interstitial there the infiltration, most probably there the infiltration, and also the some there the and hyperinflation. Now how you can diagnose the case of the laboratory diagnosis, and there the laboratory finding in case of the and they are the non-specific most probably. So there are also having there the prevention. First of all, there the pneumonia most probably occur in the pneumonia and the conjunctivitis. Differential diagnosis of case of the Guillain-Barré. There the we also can differential diagnosis. There's the Neisseria gonorrhoeae, conjunctivitis, and also the some there is earlier onset. Most probably there's earlier onset, and within the first 5 days of the first day of the 5 day of the after birth in postnatal period, postpartum. More signs, and they also can be therapy of the first of all the erythromycin. We also can giving erythromycin PO, and they also having the conjunctivitis, and also the pneumonia. There's a tropical, most probably there's a tropical therapy, and for the prophylaxis. Okay, there is the Neisseria gonorrhea. They also can be caused by the Neisseria gonorrhea. They also can cause ophthalmia pneumothorax. So this also can be called conjunctivitis, and they also can cause ophthalmia pneumothorax. They also can be caused by, and then it is also a most common infection. And there the other clinical most probably other infections, like first of all there the scalp abscess. So they also can be caused by the Neisseria gonorrhea, and there is the vaginitis, inflammation of the vaginal mucosa, and then there are the disseminated disease, and there are the sepsis, bacterias, and there are the meningitis. Onset of the disease also can occur within the first day of the life. जब बच्चा पैदा होता है, they also can be caused by the first day of life. They also can producing some symptoms like the first of all there are the earlier diseases pattern, and they are the similar to the Guillain-Barré infection. Later they also have developed the some there the corneal ulceration. They also have developed the perforation. They also developing. And how we can treat the patient on Neisseria gonorrhea and give the ceftriaxone. Some there the prophylaxis, and for the first of all there the tropical there's the administration of the tropical administration of the some diseases. First of all there is silver nitrate. They also can giving an erythromycin and the tetracycline, and for the give the prophylaxis and from the Neisseria gonorrhea infection. So this is all of about the kind of infection. We already discussed the infection comprising the most common viral infection. They can call the canal infection, like the cytomegalovirus viral infection, and then after there the rubella virus infection, herpes simplex viral infection, type 1 and type 2, and then other there the parasitic infection. There is more frequently toxoplasma, gonorrhea. They also can causing the toxoplasmosis, and some other rubella, other like the bacterial infection, like the syphilis caused by the Treponema pallidum, and also the other bacterial cause the Neisseria gonorrhea. So उसके बाद जो हमने डिस्कस किया था trichomatitis, and they also can produce some diseases. So they also can in the fetal life and after the birth. So they also can produce some infection. So this is all of about the genital infection. Thank you, beta. Asali? Light on the air. So you know, Anyway, so can you?